Hello, Kristen. My name is Kimberly Linder, and I'm a registered dietitian. How are you?
I'm good. How are you?
I'm great. Let's see how we can help you today. Let me confirm what we have recorded for you. You're currently 62 years old, your height is 5'4", and your current weight is 235 pounds.
Yes.
Okay, so what health concern brings you in today?
I saw my family physician last week, and he said that I'm considered a borderline diabetic. I am not really sure what that means, but he said he might be able to help me.
Okay, great. Before I help you understand what a borderline diabetic means, have you ever followed a special diet?
No, I've tried in the past, but nothing has ever really stuck. When my children were growing up, I used to try to cook at home at least once or twice a week, but now that they're out of the house and my husband and I are retired, we eat out quite a bit.
Okay, so when your doctor says borderline diabetic, what do you think that means?
Well, my husband's grandma had diabetes when he was growing up, and he said that she didn't eat a lot of sugar and would avoid alcohol, but that's really all I know.
Okay, that's a great start. First, I'll explain to you what diabetes is medically, and then we can talk about any diet or lifestyle changes that we need to make. For starters, you're not alone in having diabetes. It is quite common in adults. Type 2 diabetes mellitus is when your body still produces insulin, but your tissue is growing insulin resistant. Now, insulin is a hormone that's made by the pancreas that helps the cells in the body take up glucose from the blood. So because of the insulin resistance, the need for insulin has increased, and the result is that the pancreas increases insulin production. After time, the pancreas is no longer able to keep up with this high demand for insulin needed, and the result is insulin resistance and a relative insulin deficiency. At this point, your insulin resistance is still building up. This resistance doesn't happen overnight. It can take years. If we don't try and stall or reverse this process, then later in life, you may have the clinical onset where the pancreas can no longer produce the necessary amount of insulin that your body requires. How do you feel about what I just told you?
So far, I think I understand. Just to clarify, my pancreas is still creating insulin, maybe just not enough, and my body is growing insulin resistance, so even if I do produce enough insulin, my body doesn't accept it all.
Exactly. Although not all type 2 diabetes mellitus cases are the same. The cases can vary in severity, but this resistance is a result of a cell receptor defect, so your body can't use the insulin properly. This is where the problem happens. Insulin is normally secreted after a meal, but when the cells aren't able to respond to the insulin, they can no longer use the glucose for fuel. Right now, you are considered a pre-diabetic, or as your doctor called it, a borderline diabetic. This means that your body currently has an impaired fasting glucose or impaired glucose tolerance, which put you at a high risk of becoming a diabetic. With a few lifestyle and nutrition changes, we can avoid the development of this disease. Does that make sense?
Yes. So my body isn't accepting the insulin, which causes me to lack energy. But what is the fasting glucose?
That's right. A fasting glucose test is when you fast for a few hours and then your blood sugar is taken. In a patient without diabetes, their numbers would be between 70 and 100, but in a patient with diabetes, it's 126 or above.
Okay, that makes sense.
Okay, so because you're still a pre-diabetic, let's see how we can make some changes so you don't end up with the diagnosis of type 2 diabetes. Do you usually participate in physical activity or hobbies where you're active?
My friends and I have a book club, and sometimes we go shopping, but I don't really work out.
Okay, so it sounds like you haven't had a lot of opportunity to get your heart rate up. Are there any activities that you enjoy, maybe yoga, swimming, or tennis?
None that I've really done enough to say that I enjoy them, but I would try a few things.
Okay, so maybe before the next time we meet, you can try and add about 30 minutes, maybe 3 or 4 times a week of physical activity. So now we're going to look at what your current diet looks like. What is your usual breakfast?
I like to eat cereal in the morning with a cup of coffee.
Okay, what kind of cereal do you prefer?
I like to eat Frosted Flakes usually, but sometimes I eat Apple Jacks.
Okay, what kind of milk do you use in your cereal?
My husband likes 2%, so I usually just use that.
Okay, do you drink your coffee with milk, sugar, or creamer?
I like to add a little bit of milk and a spoonful of sugar.
Got it. So for breakfast, cereal is a great option. Although, cereal can be tricky because they tend to have a lot of added sugar in them. When looking at the label on the box, make sure you look at the sugar content. You can still have a cereal that tastes good, but maybe you can try to find one that is under 10 grams of sugar. When drinking your coffee, the milk is good, but try to half the amount of sugar you're using. Maybe use a half tablespoon. Do you eat anything between breakfast and lunch?
Sometimes I have a glass of orange juice.
What time is that around?
Usually close to 10:30.
Okay, so orange juice is good because it can count as a serving of fruit, but fruit juice contains a lot of added sugar. Maybe have an orange in its entirety. It has the same taste, just less sugar. What do you normally eat for lunch?
I usually eat a turkey and Swiss sandwich with potato chips and some apple slices.
Okay, what kind of bread do you use?
Wheat.
That's great. The turkey and cheese have little or no sugar. The bread is a complex carbohydrate for energy. The apple slices are a good fruit serving, and potato chips don't have too much sugar. Do you have a snack in the afternoon?
Yes, usually I like to have some yogurt and granola.
Okay, what kind?
Either low-fat strawberry or vanilla. The granola is usually honey flavored.
That's good. The low-fat yogurt is a great choice. Just remember to check your labels. When looking at granola, remember to check and compare the sugar content. Some granolas have more added sugar than others. Try and find the one with the least amount of sugar. When you're looking at the food labels, make sure and read the ingredients and watch out for the high fructose corn syrup, fruit juice concentrate, honey, maple syrup, dextrose, sucrose, and maltose. If you're looking at the nutrition label, the nutrition ingredients are found here. Okay, what do you generally eat for dinner?
Most dinners, we go out to eat. I go back and forth between steak and fries, sometimes with vanilla ice cream for dessert, or a grilled cheese sandwich with tomato soup, and my husband and I usually split a brownie sundae.
Okay, both the entrees and the meals are great. The french fries will have a high amount of fat and sugar, so maybe substitute it for mashed potatoes or a side salad. For dessert, try and limit yourself to two to three desserts a week instead of every night. And look at the portion that is recommended. Do you typically have anything before bed?
Sometimes I have a glass of milk, but we eat dinner pretty late, so I'm not usually hungry.
Okay, a glass of milk is great. From your diet history, we talked through some potential changes we can make to lower your sugar intake. Do you remember what they are?
Yes, I remember that for breakfast I should look at nutrition labels and watch my carb and sugar intake. I'll try using less sugar in my coffee. I'll substitute drinking fruit juice with eating a whole fruit. I also need to check my labels on my granola and yogurt to make sure there aren't any hidden sugars. For dinner, I should avoid the high fat and fried foods and try to limit myself to 2 to 3 desserts each week and make sure I'm watching my portions.
Wow, it sounds like you have it all down. I have a handout that can help you remember how to read the food labels and some good physical activity recommendations to lower your risk of developing diabetes. In the handout, you can see there's different guidelines to checking the labels. You'll check the serving size, check the calories, how many of each nutrient, the trans fats and sugars, and what the percent daily value is. And it explains what all of those are. There's some tips for diabetes prevention. And then there's risk factors that make you more prone to having diabetes. And then some other places you can gain more information. The week before your next appointment, I want you to fill out this food log so you can see your meals and we can assess any other changes that need to be made. I hope the next time we meet that you feel a difference in your energy and feel healthier. See you soon.